Hello, and thank you for tuning in to McDougall's Medicine with Dr. John and Mary McDougall. Tonight, we're going to get to general questions, but first, I've been told we have so many things to talk about, I can't even pick just one. So great to see you, Mom and Dad, Dr. McDougall and Mary. I'm excited to get started.
Well, Heather, there were so many things I wanted to talk to you about. I didn't have the time to write to you, but hopefully you'll be pleased and I won't go too long tonight. I'll try and keep it at under, say, 15 minutes. But there are a lot of things happened the last week
Well,
or
that
two.
just shows you how many things changed in 1 week.
Some weeks are really, there are really a lot of different studies. Other weeks I come back empty-handed, but I've got thousands of articles. And most of my, my library, you can look and you can see I probably have 300 or 400 articles over the last couple of years. And I know you want to have up-to-date references so that as we talk about every time, one of the purposes of this 5 o'clock Sunday night Pacific time, okay, McDougall YouTube channel. One of the reasons to join us here is because Heather gets a lot of complaints. She gets complaints about the references that I use, particularly my books are, they all date back before 2011. And you know why? Because the last book I wrote was in 2011. So there weren't any new research papers out. But what I try and tell you is the truth don't change. And I try and share with you the things I told you, between 1984 and 2011, and wrote 13 national best-selling books. Nothing's changed. And I took the trouble to make sure the references were accurate, not only in what they said, but accurately referenced so you could find them. And I want you to look at them. Remember, I told you, you can find pretty much all these references by going to the National Library of Medicine. Just look it up, National Library of Medicine. And then you end up on something called PubMed. You put in the article you're looking for, and it comes up with some citations. You look at the section of the citation that says DOI, okay, Digital Object Identifier, DOI. You take that DOI number and you put it in another website called Sci-Hub, SCI-HUB. Amazing what turns up. The last 100 years of research, minus 2023. I don't think they have articles published in 2023. Anyway, I try and review the things for you. I know it gets a bit repetitious for some of you, but I don't mind telling you again. I love talking about this stuff. I hope you like hearing about it. Anyway, let's see what we can find here, Heather. Oh, I know we're not going to find anything there. All right, let's see. We got to go. There we go. See, I always get so excited that I forget to
Share your screen.
yeah, I forget to share the screen. I get so excited. I work pretty hard getting these things ready for you. So how's it look, Heather? Pretty good?
Great.
All right. So let's see what I found this week to talk about. Let's see. Oh, bird flu.
Oh.
Bird flu. It's finally spread to people. They have at least 3 cases, and finally somebody died. The first 2 didn't die. The third one died. That's what's unique about this. And I want to tell you something that I've talked to you about before, is that we are at risk of diseases spread by other animals. And the reason is because we're animals. It's called zoonosis. And it's the spread of diseases from the animal kingdom to members of the animal kingdom. But diseases don't spread between the 2 kingdoms. Remember, there's the animal kingdom and the plant kingdom. So you don't catch plant diseases. You don't have aphids, Dutch elm disease, or tobacco mosaic virus. You don't have these. These are plant problems. People never catch those. Likewise, you don't catch diseases from plants. The kingdoms are too different. Anyway, so that's what you have to suspect: pigs and cows and chickens and so on. And the farming practices enhance this. So you have a great amount of fear, or you should have, for these being a problem in the near future with the rise in infectious pandemics that's occurring with global warming. It's just going to get worse. And you also know from the COVID epidemic that those people who got really sick, who ended up in the hospital, ended up on ventilators, drowned in their own fluids after 2 weeks, and then died. Those were people who had comorbid factors, the things that we cure with the McDougall program. That's right. And people who are obese, diabetes, heart disease, kidney disease, they're the ones you see in the intensive care units on the news. You know, for most of us who eat well, not everybody, but most of us who eat well, it's asymptomatic, or it's a mild disease that, probably doesn't even disturb your day at work. So what can you do to protect yourself from bird flu, etc., COVID, which what they say, it comes from bats, and you've got swine flu, and the names mean something. What do? Well, you practice public health measures. In other words, wear a mask, wash hands, keep distance. I know that's been in the topic, the news this week with Dr. Fauci. I know that, but these are still time-honored practices, have been going back hundreds of years. And then you eat well, so that your body's strong enough to resist these infections, which, are coming every week.
For these diseases, especially bird flu and stuff, if you don't eat animals, do you not get them?
Well, these people probably caught it working in the farmyards.
Oh, okay.
Yeah, it's spread it's respiratory. It's a respiratory illness. So it's not spread by droplets necessarily. These are respiratory
and not by eating them. You breathe.
But you have them in the blood of the animals too.
Yeah.
But they breathe the viruses out of their lungs. So that means the viruses are still in their body. So when you eat their bodies or you breathe their air, you catch it. And these airborne illnesses are highly infectious. Some of you are old enough to remember when we had chickenpox and measles, this epidemics. We used to have chickenpox parties where you would go into a room with other people who had chickenpox so you could get your kids infected so you could get on with it. That's how infectious that you could walk into a room where nobody had been for 2 days with chickenpox and the virus would still be alive and you'd catch it. These are respiratory viruses. Be forewarned. Let's see. And we have this problem of pasteurization, which I know you all believe in, and certainly it does work, but does it work completely? Sometimes it misses. And, I've got research, I pulled research in the last few days that shows that, it doesn't completely kill the viruses, pasteurization. There's still some left. Yeah, it reduces the risk of infection greatly. But what do you do with people who don't buy pasteurized milk? Those who eat raw milk, which is encouraged by one segment of our population, which happen to be conservatives. Yeah.
Why would people choose to drink raw milk instead of
They think it's more nutritious. These are people who believe anything that has to do with manufacturing or has been touched by human hands. They try and stay away from anything touched by science and modernization. And
Really?
what the concern is that heating the milk changes its properties so that you don't get all the immune substances that a cow has.
But
I don't know that you want all the immune substances.
But if they just drink raw milk, then they wouldn't buy butter or any of this other stuff, right?
I don't know if butter's heated or not. Is it?
I don't know.
I never even
made
looked.
butter,
Cheese is just fermented. Maybe cheese would be a problem too.
No.
Ice cream?
Yeah.
Don't say ice cream. We'll lose half our listeners, but there's non-dairy ice cream. All right, we have to move on. Okay, now this is an article you see down here in the bottom center. It says, share with friends. I've been talking to you for 25 years about how heart surgery doesn't save lives, right? I presented for you like 15 different studies. I showed you 8 of the studies. I showed you how to find the other studies done. I showed you all the studies on using angioplasty to save or not save lives. Say pretty similar thing with open heart surgeries with angioplasty, but this is mainly about angioplasty, okay? And you've looked at me, you said, well, that couldn't be true, Dr. McDougall. They wouldn't be doing 1 million of these operations a year on people without telling them that it doesn't save lives. Yeah, that's what you thought. I know you thought that. Nobody could be that blatantly lying to patients, right? Well, here's an article published in the Lancet in 2024. It's a review article. It's about what has happened over the last 25 years. And it clearly says to you, I'll read it. It is the things that I've been telling you. Rupture and thrombosis of lipid-rich atherosclerotic coronary lesions. These are the pimples I told you popped in your arteries. is the most frequent cause of acute coronary syndrome and sudden death. Remember, if you took the 12-day program, you for sure learned this. If you want to learn it again, you go back to YouTube and look at my lecture on heart disease. All right. In other words, it's not the big lesions they bypass, the hard fibrous plaques that kill. It's the little pustules that pop that kill. It says so right here in the first paragraph. Okay. And then you go on and you show current clinical guidelines recommend revascularization by percutaneous, that's angioplasty intervention, only for coronary. Oh. Come on, guys. There we go. Okay, only for coronary lesions that are hemodynamically flow limiting and have caused a acute coronary syndrome. What they're saying is if the lesion gets bad enough that it causes chest pain, then it's amenable, but it still doesn't save lives because they're treating hard fibrous plaques. And then they go on and say, as such, whether revascularization or non-flow limiting, that's those little pustules, vulnerable plaques is safe and effective is uncertain. Excuse me. You show all your friends who want to have heart surgery this one article. You don't have to have them watch the whole lecture on heart disease that I put on YouTube, where I review all the studies. This does it for you. It was just put out, Lancet 2024 May. That was 2 months ago in one of the best medical journals in the world. We know, those who read and understand, your cardiologist knows better. Your heart surgeon knows better. And maybe your general practitioner knows better too. But if they don't, I'd let them know. All right.
Do you think they read this?
I don't know whether they read it or not. Okay. Here's another one you'll be interested in is fish oil. 37 observational studies and 61 randomized control trials. Fish oil, you take omega-3 fats, fish oil to prevent heart disease. It may do that. They say it may do that a little bit, but it increases your risk of atrial fibrillation and stroke. Why? Because fish oil thins the blood. And so these pimples, these pustules I told you about in the last slide that pop and cause a blood clot to form because fish oil thins the blood, like aspirin, different mechanism. But like aspirin, it keeps the clot from forming. And so therefore reduces the risk of the heart muscle dying. But because it thins the blood, you have a greater risk of bleeding. And so a lot of strokes are due to bleeding, which the fish oil would encourage. All right, so don't take fish oil or flaxseed oil or any of those other oils. You get yourself in trouble. All right, that's an important article. You see the reference down in the right-hand corner? You're going to look that up, right?
Well, I just reading the conclusions would make me stay away from.
What does it say?
Right here.
Oh,
Regular use might be a risk factor.
well, you got a choice. You can have less heart disease and more stroke. Hey, or you can eat well. That's your other option. All right. Okay, let's see. We talked about last time, the last lecture last week, about how PSAs and prostate cancer surgery, early detection techniques, radiation, etc., do not save lives. It's a 15-year study. 15-year study just published. It's published in April, 1 month before the last one. April 2024 in Journal of the American Medical Association. I told you this last time. And I know you said, well, I'm never going to get another PSA test again. I'm going to tell my male friends and relatives not to get PSA tests because they lead to nothing I want. All right, so we have Dr. Oh, no, we have this right here. Okay, this is good. This is in Journal, okay? Open access is plant-based diets and disease progression in men with prostate cancer. It shows they studied men with prostate cancer. They lived longer if they ate the kind of diet we recommend. Hey, pretty cool. Huh? You like that study, I bet. All right, it's right here in the bottom right-hand corner. Okay, well, let's get on to some other things. I've always told you I'm afraid of the osteoporosis medications, bisphosphonates, they're called, like Fosamax. I'm afraid of them because of the side effects, plus the benefits are tiny at best. If you read the absolute benefit for Fosamax, you'll walk away and say, I would never buy that drug, regardless if it was safe or not. Well, it's not safe. Not safe. Fosamax fractures. This is the drug you take for osteoporosis. Justice has not been served. Why? They tell you that we've known that it causes an increased risk of fractures of the big bone in your leg. See this picture right here, the femur? Okay. You see the femur picture? Okay, that's a fracture of the the big leg bone, and this commonly occurs. And you know what? Merck, the drug company, knew about this for 5 years before they told anybody. What do you think? Huh? You're a little concerned? You're going to read that article too. All right. Oh, good news. Good news. Dr. Ornish came out this week and published his article on Alzheimer's disease. And he took 51 patients with Alzheimer's disease, fed them the Ornish diet, which all you know is very close to what we recommend, almost exact. And the limited study done, and it is a small study, showed a reduced progression in those who got a healthy diet. In other words, they lived longer. And I think that's really important work. They gave supplements during this study. You'll read the people who funded the study, and I have to say a lot of industry was involved, but you got to get money from someplace. So I'll give Dr. Dean Ornish the credit here, and he's been working on that for a while. So he's shown prostate cancer is reversible, heart disease is reversible. You see, I changed the title of his book. Do you notice that, Mary?
Oh, yeah.
Yeah, so now he's going to be able to say Alzheimer's is reversible. But, I've told you all along.
Did he do that? It's actually coming out that way now?
It just came out a couple of days ago.
It's the same book as before?
Oh, no, I'm just joking. I meant the editing.
Oh, okay.
Yeah, that's not true, Mary.
Oh, okay.
He doesn't really have a new book.
Okay.
I just kind of, okay.
All right.
But if you want to find out about what I believe in Alzheimer's disease and been teaching for a long time, in fact, since 2004, what's that, 20 years? Read that newsletter. It'll tell you that the Western diet, in this newsletter, the Western diet is one of the risk factors for Alzheimer's disease, the most common cause of dementia. The Western diet is. It tells you in this newsletter I wrote 20 years ago, okay? So it made sense to me then, as I tell you right now, to change your diet like Dr. Dean Ornish told you to do, because you can slow the progression of the disease by changing the diet. And then in an updated newsletter, which is June 2017, I talked about treating Alzheimer's, not from the diet point of view. That's the 2004 newsletter. You'll want to read all that in that newsletter for sure. Not by diet. It talks a lot about diet, but it starts to introduce you to the idea of Alzheimer's being due to aluminum poisoning. Okay, and that's what the second newsletter is about how to get rid of the aluminum in the body. Aluminum, the metal aluminum. The stuff that you used to cook your food in. You get the cans out. Stuff you used to spray in your nose when you used antiperspirants, right? You know that all antiperspirants have aluminum in them. Yeah, you know that. Okay, so read these two newsletters. I encourage you to. You'll see that there's well, I think it's really important that Dr. Ornish, he's a researcher. He's done a tremendous good for the population in teaching the importance of a healthy diet. All right, but this is what you're getting for Alzheimer's. Okay, watch me. On the left-hand side, this is the result of current treatments. Loquimbi is the drug. Loquimbi 18-month trial, published 2023. What they showed is a 27% chance of slowing the disease. Ornish showed better than that. Okay, but they showed brain swelling and bleeding in 20% of the people so treated. Actually, I've heard of statistics as high as 1/3 have brain damage that are treated. But the treatment has to stop then. But look at the tiny benefit, 27% reduction. Anyway, there's been a lot of argument as to whether this drug should have ever come on the market. And you'll see a lot of criticism going forward, but the drug companies got the money. They could buy the government, and they did. And my colleagues know this. Cost $28,000 to $56,000 a year for these drugs that are out. But look at on your right-hand side, okay? Look at a study done in 1980 using a chelating agent called deferoxamine, which chelates aluminum and removes it from the body. They did a randomized controlled trial, 2-year trial, and those who got the deferoxamine had twice as good ability as those who didn't get the treatment. They were twice as functional. That's even better than Ornish reported. just by taking the aluminum out of the system. I've written the Journal of American Medical Association and the New England Journal and asked them to publish a letter to the editor where I asked them, and they turned me down both times. It's been the last 6 months I've written them. I asked them to do a study which tests whether or not deferoxamine will stop or cure, not cure, but stop this disease and its progression, because the current data says it will. Yes, there need to be bigger studies done, better design studies done, but why do you wait when something costs almost nothing? There are no side effects, and it cures the disease. The disease is caused by aluminum poisoning.
Do you think anyone can get a doctor to prescribe that?
It's tough. It's just like getting a sigmoid exam.
Yeah.
The research says one thing, the practice of medicine is a decade behind. Anyway, you'll want to read all of these articles too. Okay, well, this is an approach that you might want to take. We talk about deferoxamine, which you're going to try and get your doctor to prescribe it. You look at Amazon, they sell deferoxamine there. But here's an approach you can take right now to getting rid of aluminum, and that's to consume silica. Okay, not silicon. Okay, that's inorganic. It's silica, which is organic. And it's present in some drinks, waters you can buy, not toxic. And the ability of silica to remove aluminum from the body is great enough to show a clinical difference in people. Read the studies. All right. So going on to another topic. I tell you that all large successful populations of people throughout all of verifiable human history have obtained the bulk of their calories from starch. And you say, oh, no, people are hunter-gatherers. It was the men who did the hunting. Yeah. I know. The glory goes to the men. But they didn't get any food, or not much, or it rotted. Who got the food? It was the grandparents, the children, the women. Do they get glory? Do they get glory back then or today? No, not at all, but they got the food. Anyway, as you go through population after population of population, I know of no exceptions. I mean, people used to believe differently because all that was left around the fire pit was stone tools and bones. All the banana peels and potato peels have all rotten away after thousands of years. So archaeologists came to the wrong conclusion. They said, we're hunters because we found bones and stone tools. Well, of course you would. But when you use modern day techniques, like you look at the particles between the teeth, or you do bone analysis, what you find is people lived on starch-based diets. Here's a population that was just reported this week. PLS 2024, January.
You show a picture of where they lived right there.
Yeah, that's where they lived, right?
Okay.
Okay, that was published in January 2024. Anyway, the starch-based is another example. Here's another example, just came out, I think this was last week. Fermentable, they're foods. These are people, you see where they are in Africa. So I'm putting a little map for you.
Yeah, okay.
There's a picture of their house.
Yeah. Oh.
Yeah. Anyway, they and that's one of tooth. That's one of their teeth. And what they do is they examine the particles around the tooth, Mary.
Yeah.
And they can find granules. They find starch granules. I know you can't see them. They're just little.
Well,
that's a tooth.
Okay.
All right. And so they analyze the bones and the hair and the teeth and particles around the teeth, and they find out these are starches. You can tell from that kind of examination. And I've said it so many times. In fact, it's the primary reason that you have to believe that the McDougalls are telling you the truth. And that is for all large successful populations throughout all verifiable history. We're talking about 99.99% of the people who walk this earth. We're talking about 100 billion people have obtained the bulk of their calories from starch. Why should you do different? Doesn't make sense to me.
We didn't have grocery stores back then, so now you can just walk into a grocery store and fill your basket up with all this junk.
And we didn't have trains and planes and ships either, all the communication. Anyway, part of their diet was cassava, even back then. How long ago was this? 15,000 years ago. They were eating cassava. Well, your nutritionist may tell you that cassava's protein deficient. You'll get a protein deficiency disease like kwashiorkor or marasmus, they'll tell you. Nonsense. Absolute nonsense. Cassava, which is a root vegetable, is loaded with protein. Plenty of protein for human needs, up somewhere between 3 and 10% of the calories are protein. We're talking about 800 million people who obtain their bulk of their calories from cassava, as they did 15,000 years ago. Cassava is a great food. There are no protein deficient whole plant foods, none, particularly starches. So don't let them scare you with nonsense. All right, now article, to get back to the topic that you're most interested in, which is losing weight. Reported this week is the fact that 12.5% of the population is taking these shots and pills. Semaglutides. 12% of the population is taking these things, compared to fewer than 1% of the population that's following McDougall. Yeah. Anyways, and they're paying $1,000 or $1,400 a month to do this.
How do they do that?
You like my picture?
Yeah.
The fat you eat is the fat you wear. Not starch. Okay. Anyway, that's new data that came out. And I talked to you last time about how celebrities are driving this movement. You know, whatever celebrities do, everybody else thinks they ought to do. Whatever.
Yeah.
They got the money. They certainly have the obesity. They have the need to, but they would do so much better. These are smart people, successful people. If they only knew that the McDougall diet was far better an alternative than GLP-1 agonists. And how many people need this diet? Not the GLP-1s, not the semaglutides. How many people need to go on the McDougall diet? I gave you this reference because I knew you wanted it, because you wanted to share it with some of your friends. Okay, Frontiers of Public Health, 2017. 91% of the adult population are too fat for their health. And you thought it was only 80%. No, it's 91%. 69% of the children.
Wow.
You want to put all these people, you want to put all these people on Ozempic? Yeah. Well, you know, those people in Africa and in Asia and so on, they aren't part of the market for Ozempic. You got to go to places like Australia and Europe and the United States, where we have people who look and eat like kings and queens. Anyway, these are the drugs, in case you need to be reminded of them. They're the semaglutides. More of them are coming out all the time. By the way, there are two drug companies, Novo Nordisk and Lilly. They make the drugs, only they do, and only they pay for the research that's been published. Only they do. There's no independent research on these drugs. And I've told you before, I'm not going to go over this again. This is a derivative of the venom of a Gila monster. That's where these drugs come from. And I've talked to you about the benefits or lack of benefits of using these drugs. You want to spend some time looking at this slide, going over the different points that I've made, but the important points are this. You look at the light gray line, that's the control group. They only lost a couple of pounds, but they were on a lower calorie diet. They cut their calories by 500 calories, and they exercised, but they do lose weight. They lost a couple of percentage points is what they lost. You compare that with the dark line, which is the people who got the drugs. And you see that they lost weight. They lost 20% of their body weight, maximum 20%, 12%, maybe 10%. Could be, but maximum 20% of their body weight, which is about 38 pounds based on this study. It cost them $17,000, and it took them 68 weeks, which is about a year, 0.4, about a year and a half to lose that weight. And then what happens, I want you to notice, is they stop losing weight. They have a plateau, and almost everybody has this plateau where they don't lose any weight because the body says, I've had enough. You're going to die if you keep this foolishness up. And it gets to the point where the sickness caused by the semaglutides is matched by the desire of the body to live. And you stop losing weight. And when you stop the drug, you regain all your weight. But anyway, you know all that because you have this chart. I gave this out to you several times, and I'm going to give it to you again. Heather's got it in the chat. Okay, this is comparing the semaglutides to the McDougall diet. Okay? Goes through point by point by point. You'll want to study all these points. I can show you all the references. Look at the difference. On the semaglutide diet, what do you gain? You lose 25 pounds. Well, they started bigger than our group did. We lost 22 pounds over a year. Oh, basically the same. We have no plateau that we reach. You'll drop until you hit skin and bones. Well, not exactly. You'll still have some muscles, a little fat. Adherence at 12 months, we've proved that's 85% of the people. You get only 27 to 50% to adhere for a year to these drugs. They tell you this decreases food noise. What it does is it decreases noise for everything. You don't enjoy music, your hobbies, your friends. You don't enjoy anything as much. It just dulls all your senses. It works by giving you nausea, vomiting, bad breath, and so on. Anyway, the cost is a big deal. Well, I'll let you read the next page by yourself about losing muscle mass and bone mass, and it's just a horrible thing. But when these smart celebrities figure out that they're getting cheated, they're being made fools of, they might do something as desperate as following a starch-based diet. What do you think? They might. You never know. I've seen them pass on it before, especially Oprah many times. Dean Ornish tried to get her to change many times. All right, so here's the second page. The bone loss. Read it. Our program in a year, here 7 days, the weight loss on average with 1,700 people is 3.1 pounds. Our 1 year studies, 19.1 pounds and 25.3 pounds. So I kind of averaged those two out, and I told you we lose, 23 pounds in a year. Now, that's average weight loss. You don't have to take any drugs. You don't have to spend all this money. Okay. So, I believe in a starch-based diet. They kind of know me as Dr. Potato. Hey, you can call me Dr. Potato if you want, or Dr. Vegetable, but don't you call me Dr. Lard, which is a whole newsletter I wrote about Dr. Lard, which is a guy named Krause who works at University of San Francisco or something. He's a big meat promoter. He works for the meat industry. I call him Dr. Lard. There's a whole newsletter on that. But anyways, I'm Dr. Potato. Just plan on it. And I'm proud of it. So potato, I think the potato has the best chance of saving the world. It grows under the most different climates, mountaintops, seashores, different temperatures, different humidity. The potato is amazing at what its ability is. We cry to mother for help. She screams back, help. We're doing that now. We're crying, help, mother. And she screams back, eat potatoes. Yeah, because you know that half the greenhouse gases come from the animal agriculture industry, and you can cut your CO2 production overnight by 80% when you change to the kind of diet I recommend. All right, what you hear about and you're going to hear about forever, because you have to, because we've passed the CO2 limits, is you're going to hear about what we have to do is geoengineering. And you're going to read that in the paper, and all these geoengineering programs have flaws that are serious enough that most of them have been stopped. Here's another fun. How funny is global warming? I'll let you read that later. Washington Post. Who gets to decide if we re-engineer weather or not? And they talk about mirrors and clouds and putting all kinds of dust up in the atmosphere. They talk about mirrors. And here's a satellite. An umbrella that they put out in outer space. Can you imagine how much that would cost and how difficult that would be? Oh, and here, this tells you Earth is likely to surpass 1.5 degree mark very soon. I'm not even going to tell you how soon. You can look it up if you want to have a bad day. Anyways, it's time to act. And if I thought there wasn't any option for you, I wouldn't say it. But I keep interrupting these presentations on 5 o'clock on Sunday evenings. 5 o'clock Pacific time on our YouTube channel. I know you'd rather I wouldn't do this, but I've got 7 grandchildren. I never want them to say, Grandpa, why didn't you try harder? Even if I only have a small audience to talk to, maybe one of you knows somebody who can make a difference. And that difference is MEER. MEER, MEER.org. Go there. They have a practical way of geoengineering, but it's a nonprofit. It's all done by volunteers. There's no money to be made. The mirrors are made out of discarded plastic bottles and aluminum tin cans. And they cost $10 a piece, and they can maybe be in people's backyards. Excuse me. Go to MEER. Anyway, Heather, I'm done.
Oh, that was long.
That was long. I'm
That
sorry.
was way longer than 15 minutes, but it was great. Very important information.
sorry.
Thank you.
As I said, so many things I wanted to talk to you about. But anyway, they have the half an hour I spent, Heather, and they can go back and they can look up the references and they can read what I'm trying to share with them. Look, I'm not misleading you. I'm not exaggerating. I'm trying to give you an honest message that costs nothing, totally under your self-control. Don't have to go to see a doctor for it. A way of getting your health back. And the thing I plead is that you give us a chance first. That's all. There are lots of people out there that'll treat you the other way. They'll do heart surgery on you, fill you full of a bag full of drugs. They'll do that every day. They do that to you every day. I know they do. Give us a chance first. Give us 4 days. 4 days. Here, 4 days. 4 days. That you'll see the benefits. Give us a week. Most arthritis patients already see the improvement in 4 to 7 days. Give us at least till 4 months. If you don't get well within 4 months, then go find somebody else to listen to. You'll get well in 4 months. Yes, you will if it's a dietary disease that's amenable to treatment, which is probably 90% of the problems you have. It's the food. I'm sorry, Heather. You got me going. I can't stop.
That's all right. We love it. Okay, lots of questions coming in the chat while you were talking. Starting from the top, JM is writing in, wants to know your opinion on getting B12 shots for someone that's chronically deficient and all other methods don't increase values.
Well, I would be surprised if they didn't increase values. You want to look up, there are 2 articles on B12 on my website that I've written. And in one of the articles, it references to studies done giving large doses of B12. And what they show, let me give you some numbers here, is you need about 0.5 micrograms of B12 daily. Okay, we recommend 10 times as much, 5 micrograms a day. That's what the McDougall diet recommends. As little as 0.3 micrograms will correct pernicious anemia, which is the most severe form of B12 deficiency. All right. So, I recommend that you, 5 micrograms a day. But you go to the store, you can't five microgram pills. You can only 500 or 5,000 micrograms. And you say, why are they giving me these big doses when I need so little? It's because they're taking advantage of passive absorption. And that's the articles you'll find when you look at the newsletters. It shows if you give large enough doses, like 1 to 2 grams, which is 1,000 to 2,000 milligrams, if you give large enough doses, B12 deficiency will correct by something called passive diffusion. In other words, it passes without any activity through the gut wall into the bloodstream. Otherwise, B12 is absorbed through an active mechanism involving intrinsic factor, which is produced in the stomach. When B12 and intrinsic factor are attached together, the B12 in your body will last you 30 years because it so efficiently recirculates it. So go look at those articles. Talk to his or her doctor about the fact that they don't have to get the shots. And of course, you'll want to check like 6 months later and see what your B12 levels are, just in case you're that person who somehow or another slipped through the cracks. But there are two research papers on there that tell you large doses of B12 will take care of the problem. Orally. Now you don't have to get shots. Okay, Heather.
Are there any negatives to getting the shots?
It hurts. And plus you got to go to the doctor's office. You got to go in to see the doctor. You got to wait in the waiting room. They probably find something else wrong with you, and you'll have to go for heart surgery. And all you came in was a B12 shot. No, stay away from these people. Stay away from doctors' offices. But, no, there's no side effects to it. As far as I know, there's no adverse effects to B12. But I'm open to hearing about it if there are. So far, not so. But anyway, Mary and I don't know what Heather does, but Mary and I, we take B12 when we remember, which is, I don't know, enough to keep us on. Enough so I checked my B12 about a year ago. I was just curious about a few things. Cholesterol was like 135 and my B12 was like 650. That's from taking those darn pills, not from eating meat, I'll tell you that. 650. Jeez, I'm overdosed.
Overdose.
I got enough B12 to last me for 6 lifetimes. Well, if I could only live 6 lifetimes.
You have to stop taking those pills. You won't need them anymore.
I don't need them anymore.
Oh.
but I want to make sure people know that we really recommend B12.
Oh, yeah.
So I keep taking them
Okay.
till they're gone.
Thank
You know,
you.
the other thing about B12, it comes from bacteria. I want you to know I don't live very hygienically. I don't wash everything. I don't sterilize everything. And I have some very close relationships with somebody who's very dear in my life who gives me bacteria. I'm not going any further, folks. I'm not going to tell you anymore. But all you need to know is I get plenty of bacteria from a source close enough for me to pinch. All right.
Thank you.
Yeah,
More
give
than
me
you
some
ever wanted to
bacteria.
know about B12.
Yeah,
Okay, next question. This is from Cherish. She's wanting to know for someone who has low hemoglobin, what is the best iron supplement besides food?
I think ferrous sulfate, as I remember, Heather. There are different iron supplements, and it does make a difference as far as tolerability goes. But I would have to look it up to tell you which of the ferrouses are best. But I think it's ferrous sulfate that I used to recommend. And you want to take it, it's going to make you constipated. It's going to give you black stool, which may fool you. You might think you're bleeding because a classic sign of really severe bleeding of the upper intestinal tract is black tarry stool. So you might get confused there. You might get constipated. If you consume dairy products, that'll complex the iron and prevent it from being absorbed. You need to know that. So you don't want to eat cheese or ice cream or stuff when you're taking these iron pills. So you'll have to look it up, see which one's recommended nowadays. But again, there's lots of iron in our food. You don't have to take pills. You know, and it's better absorb the iron in our food because of the ascorbic acid, vitamin C. Vitamin C enhances the absorption of iron. So vitamin C is only present in plants. So you're eating a plant-based diet, you have the ascorbic acid, vitamin C, okay, that enhances iron absorption. So you're much better able to absorb any iron that's present in your bowel. But anyway, you get loads of iron from the food. I don't know. You know, I don't prescribe iron supplements to people. I suppose I would if somebody ran a really, really low hemoglobin and I was desperate and I wanted to see if anything would make a difference. I'd put them on a little iron, but you know, wouldn't be my first choice. If you're anemic, you need to first of all find out why. Are you bleeding? You'd be bleeding and you wouldn't know it if you were bleeding from your vagina and or from your bowels. You know, that way you could have bleeding that was significant, which you're not even noticing it. You need to check to make sure you're not having any bleeding, obvious bleeding, or from the vagina or the bowels. And then you go on to looking for other causes. But don't jump right to the, to the iron pills or the blood transfusions, et cetera. We tell you there's something called Heiner's syndrome. It occurs in children, and they develop severe iron deficiency anemia. And this particular problem in kids, you can look it up. This particular problem, they've tried to correct this in the 1920s. They tried to correct it with blood transfusions and iron supplements. They were not able to do it until they took the kids off the cow's milk. It was the cow's milk which caused such profound iron deficiency that they couldn't even correct it with pills or transfusions. So get off the dairy. I can't think of anything good to say about the dairy, including the bird flu.
Thank you. Next question. This is from Tina. She's wanting to know what your thoughts are on acupuncture.
Well, yeah, I'm not an expert in acupuncture. I've known very little about it. I've run into a few acupuncturists. Yeah, you've had some experience.
I did. I had some.
Did you get better?
I don't think so.
No, I think I went once too.
Yeah.
Didn't get better. But obviously a lot of people believe in it. So it doesn't hurt, do you any harm. It's relatively inexpensive. I'd give it a try. I think it's reasonable. But my experience with this has not been that positive. Plus my reading of the science says that there is science that says it does help. So there's no reason for you not to try it. And you want to find somebody who's skilled. And that may be kind of hard to do. I don't know what you have to do to be a registered acupuncturist or a non-registered acupuncturist. Maybe you could just be a massage therapist or maybe a hairdresser. Could be.
Well, you must have to have some training.
I don't know. I don't know.
I would think so.
Make sure you have somebody who's good at it and has some experience. Ask around.
Absolutely. Thank you. Okay, Dan's writing in and he's wondering if the McDougall diet can help with venous insufficiency.
Venous insufficiency. Well, again, I would have to guess what he means by venous insufficiency. I assume what he means is he's got iron pigment, in other words, brown spots in his legs, and he may have some varicosities, varicose veins, and that would be venous insufficiency in my thinking. You start with the veins get dilated and the valves in the veins in the legs. This happens in the legs mostly, or any dependent part of the body. But the legs are, of course, the most dependent part of the body as far as gravity is concerned. So what happens is you're constipated. That's how you get varicose veins, is from straining. You strain to move the hard rock fecal marble called the American stool. Hard rock fecal marble. Got it? Okay. Some of you do. I know you do. Anyway, you push that little guy out with a lot of effort, say a half an hour of grunting, groaning, and straining. You dilate the blood vessels in your legs, and they become incompetent. You get varicose veins. You dilate the vessels in your last part of your intestine, in your anus, and you get hemorrhoids. You put strain on your diaphragm, and you get a hiatus hernia from constipation. You put strain on your uterus, and a woman gets a prolapsed uterus. The uterus hangs out of the vagina from all this pushing and grunting and groaning and straining. So once you destroy the veins, venous insufficiency is what this man has, then the blood backs up and it leaks through the vessel walls, and the iron, you know what color iron is, the iron stains the skin. And so you see these brown spots from the iron staining. Will it go away? Probably won't live long enough for it to go away. Will the veins grow back normally if you eat good? No. Can you keep them from getting worse? Probably. I think so. You know, you take the strain off, it's amazing how happy the body gets. But these are mechanical problems. This is a mechanical problem which is fixed by mechanical means. In other words, if you have hiatus hernia, there are surgeons who will take and drag your esophagus back down to your abdomen. You got hemorrhoids, they'll cut them out for you or put bands on them. Got varicose veins, they'll shoot those guys up too. In other words, you've got a mechanically caused problem. You have to have a mechanical solution. It's a dietary disease, but only secondary to the grunting, groaning, straining but it happens every 3 to 15 days when you go to the toilet. Oh, more than every 3 to 15 days, huh? You must be on the McDougall diet then. I'm not joking. 3 to 15 days, some of your friends and relatives go every 3 to 15 days with the use of a laxative. And they think that's normal.
Can't imagine. I just take it for granted.
I know.
You've never known any different, Heather, unless during your teenage years you got far away from us.
Maybe a little too many dairy products stopped me up, but that was decades ago. Okay, next question. Oh, go ahead.
I was just going to say that would be your punishment for being a radical teenager, because you get constipation because you defied your parents' advice and you went and ate at McDonald's.
That was how I rebelled.
Show my mom and dad, I'm not going to take drugs. I'm going to McDonald's.
That's right. I'm embarrassed to say. Okay, next question. This is from Karen. She's wondering if there's a way to get rid of gallstones.
Yes, there is. The surgeon will take them away. Oh, I know that's not what you're asking about, were you? They can do open surgery where they cut a 9-inch hole below your rib cage, or they do laparoscopy where they take a couple instruments and they go in and make a couple tiny little holes. In fact, when they went from the open surgery to the laparoscopy, it became so easy to do that the incidence of removal of gallbladders went up 400% overnight. Not because there was more gallbladder disease, it's because the surgeons went after them. What?
Can you remove gallstones from the gallbladder and leave the gallbladder still there?
But they come back.
But what if you change the way you eat?
Well, you could do that with McDougall too. There's a drug which doctors can prescribe. It's still on the market, which is a bile acid, which you take, and it was real popular about 25 years ago, but it's still sold, okay? What you take McDougall, and it's a bile acid mixture such that it causes the stones to dissolve. And the stones go away after you take this. The reason it's not popular today is they come back. And as you said, Mary, the reason they come back is because people are eating the same diet that caused the gallstones in the first place. Now, what if they were to switch to the McDougall diet, take Actigol first and go on the McDougall diet? Would they not come back? I would guess not. Pretty sure not. I mean, they never occur in populations of millions of people. Millions of people who live on a diet like ours never have gallstones. You look at my January 2013 newsletter, and you'll hear that story about Africans. No gallstones. Anyway, 10 million of them, 10 million people. So I would guess they wouldn't come back. But the other thing to know is that in studies done where you find gallstones, okay, in one group, you immediately operate on them. The other group, you don't. You delay any surgery until they get into trouble. Every single study that I'm aware of shows you're better off not getting the surgery done immediately. Don't treat asymptomatic gallstones. In other words, if they're there as they are, I mean, 40% of the females in their 40s have gallstones. Leave them alone, unless they hurt. And then you may want to change your diet. That's a good reason to change your diet because the pain goes away in most cases. But say it doesn't. Then you got surgeons out there be glad to take your gallbladder out. Say they do. Well, you only have a 50% chance of feeling well. Half the people who, after they go through surgery, are still sick from gastrointestinal distress, even after the surgery. Think about those statistics before you decide on what to do. Give us a try first. Okay? That's all we ask. You know,
because if there's no gallbladder there, then all the stuff just goes right into your intestine.
And then you get diarrhea.
Yeah.
But half the people who have the surgery are still sick. So, you know, they went to the surgery to get well, and they didn't.
Well, they're
still eating the American diet.
They're still eating the same food.
She gets it. I'm keeping her. She's going to be co-host forever. Maybe you'll be host. I like to be co-host for a week.
No.
All right, Heather, let's go.
You make a good team. Okay, next question. Stephanie's wondering if it's true that we should be avoiding potatoes during pre, post, and any stage of menopause.
Never heard of that.
Me neither.
Absolutely never heard of that. Look, the Incas, you know, for thousands of years, lived on the bulk of their diet from potatoes. I'm sure when they got pregnant, they didn't give up potatoes.
Or went through menopause.
Oh, went through menopause. Yeah, I got that wrong, didn't I? You know, maybe they didn't live long enough.
Oh, yes.
Oh, they did. You know, you look at populations like that, like rural Africans or people from long ago, about, you know, as many as 10% of people are still alive after 60. So they're old enough to go through menopause. But I've never heard that you should eat potatoes during menopause. I would just say eating potatoes at menopause will probably make your menopause much easier.
Yeah.
Yeah. And plus you'll get rid of weight. You'll have a good bowel movement.
All those things.
You won't go demented from Alzheimer's disease. You avoid the bypass surgery, which I just told you doesn't work. And you're going to take that article, your friends, aren't you? Remember, it was 2024, published in the Lancet, the most respected journal in the world. It said it doesn't work. McDougall can say it doesn't work all day long, and your friends aren't going to listen. Hand them the article. It's available for you.
Thank you. Next question. I know I'm going to pronounce this wrong, so bear with me. What are your thoughts on helping cholinergic or urticaria?
Urticaria. Cholinergic urticaria.
Yes.
At least I learned something in medical school. You know, these days I have trouble pronouncing anything. But cholinergic urticaria, that's hives.
Well, that's what it is.
I wish they would have written that.
Say hives. Oh, it's probably a special category of hives, cholinergic. I don't know what that is. But urticaria are hives. You know what hives look like? They're swelling, you know, around your eyes and fingers and face. Well, drugs would be the first thing I think about, any medication. And the second thing would be the food. And the things that cause allergies are the animal foods, particularly dairy, but all the animal foods do. They cause autoimmune diseases, allergies, and all kinds of things. So I would approach it from a dietary point of view, but don't forget the drugs, any medications you're taking, any herbs you're taking. Some of you forget about taking the supplements. You think that these aren't medicines. They are. I just had a patient who went into liver failure from the supplements that they bought from Amazon. There's some of these herbs are toxic in addition to wasting your money. So be careful.
Thank you. Next question. JM's writing in wondering if Accutane can have long-term side effects.
Yes. Accutane is a drug that was once given just to teenagers for acne. And they went into all kinds of problems. I believe there was problems with their genes. They got really, I'd have to look it up, but Accutane went out of phase. And they use it for other things now too. Again, I've read about it, but it's a very extremely toxic form of vitamin A. It's vitamin A is what it is, a derivative of vitamin A. Retin A is. And the drug companies figured out how to concentrate the active part of vitamin A, retinol, into this product called Accutane, which is extremely toxic. So not very many kids take it anymore for acne. But as I say, I think there are a couple other indications for it too. Look it up. Look up the benefits and risks, but also realize that acne is a disease of the Western diet. What happens? You eat the greasy Western diet. I can show you populations of people where nobody has acne. In fact, you can go to my newsletter. You can put in the question mark, acne, and you'll find the article right there. But there are populations of people, hundreds of thousands of teenagers, no acne at all. Of course, they eat starch-based diet, McDougall kind of diet, but you eat grease, you eat animal fat, vegetable fat, and it goes on your skin. And the bacteria that make acne love that kind of fat. They just eat it right up. And some of the bacteria are very, very virulent, and they'll cause big sores on your face. And you see these people with horrible scars. Again, prevented 100% of the time with a diet. Can you imagine telling a teenager this? I mean, really telling them that, so they really understood it. When I was a teenager, I made sure every hair was in place before I went to school. I had a little spot on my face. I had to cover it up. I just couldn't have anything wrong with me. And to walk into the classroom with a face full of disease, can you imagine if teenagers knew this and that they could do something about it? Good grief. Ruins their life, their personality, their attitude about things. Their chances of getting a job and getting a mate, everything, due to the damn steak and vegetable oil. Horrible.
Do you recommend the book that the Nelson twins wrote?
Yeah, I wrote the introduction to a book on diet and acne, but it's put out by the Nelson twins. So you can find it out there. Okay, diet and acne, and I wrote the introduction.
Thank you.
Anyway, they run some clinics. They help people. They run some ongoing programs to help teenagers with their diet change. It's just there's no money to what we're doing. That's the problem, is you don't have millions and millions of dollars to educate people about the importance of diet. So that's why we're losing. It's the money. But if we could get all those celebrities to go on the McDougall diet and give up their semaglutides, maybe they'd give us their money.
Okay.
We've helped a lot of people. I'd have to say, if I was that kind of a person, I'd say you owe us. Yes, you do. You owe us. But I don't practice that way. I don't never feel that way at all. But think about it. I mean, if you could give back, and the way I ask you to give back is tell your friends and relatives. Okay? Spread the good news. If you really like these people, tell them about our message. Tell them about Sunday at 5 o'clock Pacific time, YouTube channel, McDougall. Give people, only the people you love now. Don't tell the other ones.
I think that the reason that people really like our show is because where else can you go and ask a doctor a question about your health.
Get an answer that
And
works.
get an answer.
That works.
Yeah.
Besides being drugged and excuses.
And without having to go into a doctor's office and go through all that, and then whatever they give you doesn't work anyway.
Mary, why we've done this. We on our website, it's the McDougall program, 12 days, free, no gimmicks. Tells you exactly how to do the program, no charge at all. We've always given the program away. I'll tell you why. 2 reasons. One, when we first started this program, we couldn't even give it away. Okay, that's all what people thought about us. Since then, and at that time, we felt Mary and I were given such a gift. I was almost dead by the time I was 30. I told you I weighed 80 to 90 pounds more than I weigh now. I had a stroke, had major abdominal surgery. I had a stroke that, here, I'm 77 years old, and right now it's bothering me more than it ever bothered me in my whole life. I've been living with it for 58 years.
Yeah.
Yeah. But, I'm getting older and weaker and so on. So it's becoming more of an issue, the stroke I had when I was 18. But, it saved my life. And Mary, she's a moderate person, so she's probably done okay. Just imagine her 40 pounds heavier, though, with a few acne scars. Yeah. Anyway, so we always felt like we owed it to you. It's done so much for us. In addition to making a living, we've been able to work and feel good about ourselves. We get up in the morning, we look in the mirror, and we're happy about what we do. So that's why we do it. It's not to make money. If we were just into money, we'd figure out some way to trick you into. Oh, Heather, you are selling those pills, aren't you? You do told all these people listening to the show that the diet doesn't work unless they buy these little green pills. You take 4 a day, they're $4 a piece, and they have M for McDougall and money stamped all over them. Our diet doesn't work unless you send your money to Heather. You can just write a check. You can send a credit card. You don't really have to send $4 a pill. You can send your whole life savings. We'll take it. Boy, the diet will work then. And it's kind of like some of the institutions out there. The more you give, the more you're forgiven. So, if you give more than 10%, you probably have a better chance of going to heaven, right?
Maybe.
Who knows? Oh, come on.
All right, time's up. That was a great hour. Went by fast.
It was fun.
So-
hour. Go ahead, Heather.
Well, I just wanted to make a special announcement that we will not be here this coming Sunday. It's Father's Day, so we have special plans. So we didn't want to miss you, so we'll be hosting a special show this Thursday at 10 a.m. Pacific. So we'll be on YouTube Live, 10 a.m. this Thursday, 10 a.m. Pacific, and you can catch us there. So we won't be live on Sunday night.
Thursday, no, Jack.
That's good.
Thursday.
Yeah, well, and Heather, you've got another, I know you're full or almost full for the July program, but people need to know there's a waiting list if there's not any place. And so we're running another 12-day program, which when you get done with it, you're going to say, I challenge you with this. You're going to say, this is the best time and money I ever spent. It's not that it's, really inexpensive, but it's reasonable. It's 1/3 of what we used to charge. 1/3 of what we used to charge when people came out to Santa Rosa. You spend 3 times as much as our telemedicine program. Anyway, we're
Someone
on that.
just wrote in that went through the 12-day program this past January, and they're at their ideal weight, their goal weight, and they could have never done it without going through the 12-day program. So it's definitely life-changing. So we have a few spots left for July. We do have a waiting list, and we're taking reservations for October. So thanks, Mom and Dad, Dr. McDougall and Mary. That was a great hour.
Thank you, Heather. You did a great job. You too, Mary.
We'll see you all at 10 a.m. Pacific for our special live show. And happy Father's Day next Sunday.
Well, thank you.
Thanks, Mom and Dad, Dr. McDougall and Mary. Thanks, everyone, for tuning
Heather.
in.
Great job.
All right.
See y'all later.
Bye-bye.